Welcome to this Hurley Healthy Living event, Stroke Prevention and Detection. If you have questions you'd like answered live, you can text them to 248-935-2562 or submit them on Facebook or YouTube. The experts will answer your questions following their presentations. We start by introducing you to Sarah Clements, the Hurley Stroke Program Manager. Sarah has been at Hurley for 18 years and ensures the highest quality of care and outcomes for patients in Hurley's stroke program. Sarah?
Hi, my name is Sarah Clements. I am the Stroke Program Manager at Hurley Medical Center. Today I'm going to talk about stroke prevention and detection. A little bit about my hospital is Hurley Medical Center is a primary stroke center. We were awarded the Stroke Gold Plus Award by the American Heart Association's Get With The Guidelines. This means that our patients get improved care with stroke, reduced stroke complications, and faster recovery. We do this by giving high-quality care by evidence-based practice that helps decrease our long-term effects of our stroke, promotes better recovery. So first off, what is a stroke? About 800,000 strokes happen a year in the United States and almost 32,000 in Michigan a year. So I'm sure that you guys all have had somebody that you know that's had a stroke in the past. A stroke is when the blood flow to the brain stops and the brain cells die. There's 3 different ways that this can happen. First one is an ischemic stroke, when there's a blood clot or it plugs a blood vessel in the brain and stops the supply to the brain. And then there's a hemorrhagic stroke, and this is when a blood vessel breaks open in the brain and you have bleeding in or around the brain. And the last one is a transischemic attack, or a TIA, or some of you guys know it as a mini stroke. This is like a stroke, but the blood flow to the brain only stops for a short time. How do we prevent a stroke? Be proactive. Learn your risk factors that you have. Learn signs and symptoms of a stroke and what to do. Go to your doctor's appointments. Make sure you get annually your blood checked. Work with your provider on your risk factors that they're able to help you with. If you don't have a provider, the community does offer free stroke screenings monthly. The next one is March 27th at the Genesee Free Clinic, where doctors and nurses volunteer their time and help do stroke screenings. So what are risk factors? Risk factors are something that increases our chance of developing a stroke. There's 3 types of risk factors. One is risk factors that you can't control. 2 are factors that you can treat, control with the help of your care team. And the third one is things that you can do to change your behaviors. So risk factors that you can't control: increasing age. We can't do anything about our age. The older that we get, the higher risk that we have of getting a stroke. The next one is family history. If you've had a parent or a grandparent, sister or brother that's had a stroke, then you are at higher risk. And then the last one, if you've ever smoked, even if you've quit, you are at a higher risk of having a stroke. Risk factors that you can control: diet. Eat foods that improve your heart and brain health. Examples would be low sodium diets, veggies, fruits, diets with low cholesterol, less like red meat, and then low saturated fat. Also increase your activity. Doing 150 minutes at least a week, which is like 2.5 hours a week, would help decrease your stroke. And then smoking or excessive alcohol use. Just take steps to stop. Risk factors that you can work with your health team on: high blood pressure. If you've ever been told that you have high blood pressure, work with your provider to decrease it. Take your blood pressure medicines as they scheduled or ordered them. A normal blood pressure is 120/80. Diabetes. If you have diabetes, keep your blood sugars under control. Take your prescribed medications. High cholesterol. Work on decreasing your numbers using diet or exercise, and then the doctors might even prescribe a cholesterol medication for you. Other disease states that you need to contact your doctor and manage these conditions quickly would be peripheral artery disease, AFib, sickle cell disease, and many more. Make sure that you're going to your annual doctor appointments. So what are signs of stroke? It's an easy way to remember: be fast, spot a stroke. Each letter represents something that stands for the things that you want to watch for. B is for balance, like a loss of balance or a headache or dizziness. E is for eyes, blurred vision, or maybe you can't see. F is for face. One side of your face might be drooping. A is for arm or leg weakness. One side of your body, the arm and leg, might be very weak. And then S is for speech. Speech difficulty, maybe you can't speak, can't find your words. And T is for time to call for help. So what do you do if you have signs of stroke? Call for emergency help right away. Call 911. Go to the closest emergency room. The sooner the treatment begins, the better your chances of recovery are. Thank you.
All right. We do have some questions that have come in. Laverne is asking, how can I lower my cholesterol?
Diet and exercise is the best. Making sure that you're eating healthy, getting enough exercise would be the best.
Carol wants to know how early warning signs show up. We often think like the signs come and then it's, right, it happens right after. Like, can they progress or?
Yes, they can progress. I mean, the signs can show as it's happening, but you just go to the go to the hospital right away so that you can get treatment.
And finally, Michelle is asking about nutrition or diet classes. Are there things like that to help you prevent a stroke?
Your doctor actually might be aware of some that are local to you guys, so you could ask your doctor. Or also at that health screening, the stroke screening that I was talking about, they will be doing nutrition too.
Okay, great. Thanks so much.
Thank you so much.
Dr. Mohammed Al-Kazmi joins us up next. He is board certified in neurology and vascular neurology. He's had an internship, residency, and fellowship at Henry Ford Hospital. If you have questions for Dr. Al-Kazmi, text them to 248-935-2562 or submit them on Facebook or YouTube. He will get to your questions right after this presentation. Dr. Al-Kazmi?
So good afternoon, everybody, and thank you for taking time out of your busy day to join us today. We'd like to speak about stroke and a little bit more of the science behind stroke, what happens during stroke, why time really of an essence, and why we chose Be Fast. Part of it is that we would like you to be fast when you try to recognize or when you see somebody with symptoms of stroke. So stroke is very common, as Sarah mentioned just a few minutes ago, about 800,000 cases of stroke in the United States annually. And that number is actually projected to increase over the next decade. We're projecting about 1 million of new cases of stroke every year. It remains the fifth leading cause of death in the United States and actually the first leading cause of disability. About 1 in 4 people with stroke may die by the end of the year because of their stroke or as a consequence of stroke. And we used to think that stroke is only of the elderly. Actually not true. 1/3 of strokes are people under the age of 65. We all remember Luke Perry, who was 52 when he had his stroke. So just to put things in perspective about how common stroke is in the US, every 45 seconds in the US, somebody suffers from a stroke. Every 3 minutes in the United States, somebody dies from a stroke. Up to 50% of people never regain functionality, and up to 1/3 of the survival are forever disabled after a stroke. So that is why public awareness is really important about stroke sign. We have a golden opportunity in the first 3 up to 4.5 hours, or sometimes up to 24 hours, depending on the situation. Time is neuron, time is brain. I want you to remember that. It is almost like a horse race. In the first 32 seconds of stroke, in the first second of stroke actually, 32,000 neurons die. In the first minute, almost 2 million neurons die, and in the first hour, 120 million neurons die. And neurons do not regenerate. Once we lose these neurons, we lose them forever. It is estimated that at the end of the stroke, about 1.2 billion neurons are lost. And people estimate that to be about 2.7, 2.8 of aging during a stroke. And the blockage of any artery more than 5 minutes leads to these symptoms. Also, stroke is very expensive. It costs us and the people who suffer from stroke quite a bit. According to some data, over 60 millions, and this is old data actually, 60 billions rather, are lost because of stroke, and this is a direct cost because of the burden on the health care. The indirect costs can also be tremendous. We're talking about over 20 billion annually because of the comorbidities, the loss of productivity, etc. There was a study that came out from Ann Arbor, and they're estimating $2.2 trillion as a cost for stroke. So that's why we need to be fast, and that's why remembering the acronym Be Fast is important. In the acute phase, certain area of the brain loses supply forever, and it is damaged forever. It's called the core, and the core is unfortunately an unsalvageable area. What we really try to target is the areas of the brain that is around it, that has enough blood to keep it alive, but potentially non-functional. And those are the areas that we try to salvage. It's called the penumbra, where it's an area of the brain that has enough blood to keep it alive, but non-functional. It's almost less than 25 to 30% of the blood supply that gets to that area. And that's what we try to do in the first hour. Things change nowadays with stroke. It used to be that a patient comes in with stroke, we just park them on the side, we'll get to them when we get to them down in ER. We're talking about 20, 25 years ago. Nowadays, it's a completely different story. When a patient walks in through ER, code stroke is alarmed for everybody to be set. The CAT scan is being emptied in arrival for the patient with stroke. Given that we are a primary stroke center, we have to fulfill certain very strict criteria in order for us to get that certificate, and more so to be the recipient of the Gold Plus Award. So we have certain criteria we have to go through, where it's a team of doctors, nurses, and support that actually cares for those patients with stroke. And again, there's the modifiable and the unmodifiable risk factor. The number one unmodifiable risk factor is age. After the age of 55, every decade, our risk for stroke doubles. Family history, gender, race, any history of prior stroke. I also want you to remember an ounce of prevention is always worth a pound of cure, right? So if we are proactive about limiting our risk for stroke, controlling our blood pressure, exercising, that's really important. When it comes to cigarette, we really need to stop smoking, period. Maybe gradually, maybe you can speak with your doctor about certain things that can help you quit smoking, but your goal should be to quit smoking. We often recommend Mrs. Dash diet or even the Mediterranean diet. Speak with your doctor, see if there's a diet that might be good for you. Mrs. Dash diet is usually low in sodium, can reduce our blood pressure and subsequently reduce the risk of stroke. There's the Mediterranean diet as well that has been suggested. We all go to, franchise and fast food places, and we order and we order and we order, and at the end we say, well, don't forget the soda to be diet soda. I don't think that helps as much. So we have to be a little bit more proactive, not like our friend here who's sitting down, laying, smoking, drinking, and not doing much. That guy's risk is really, really high. Also, limiting our alcohol intake. I know that a glass sometimes is good, but we have to be careful not to exceed that. We live in Michigan in an area that has higher risk for stroke, so we have to be aware about our risks of stroke and try to do something about it. In conclusion, stroke is common. It's also very expensive to the society and to us. Stroke victims are on the rise over the next decade. Recognizing stroke is very important, so we need to be fast. Remember that. Be fast. Time is neurons. The sooner we get to a hospital, the sooner we can administer TNK and clot busters, the better things are, the better the outcome. Hope you have a great day.
Well, this is your chance to get your questions answered by submitting them on Facebook, YouTube, or texting to 248-935-2562. Dr. El-Kazmi, there's a couple questions that have come in. People are concerned how stroke is connected to other health conditions. Scott says, is there a link between stroke and diabetes, hypertension, and migraines?
So yes, people who are diabetic, people who are hypertensive, if their condition is not controlled very tightly, especially with the blood sugar and the blood pressure, then their risk is exponentially high. Migraineurs, especially migraine with aura, with the symptoms of visual symptoms, have been associated with higher risk of stroke, which is why it's very important that when it comes to blood pressure, we need to monitor our blood pressure, make sure that our medications are appropriate for us, so further discussion with your primary care doctor and with your doctors in general. Same holds true with blood sugar. As for migraine, you need to speak with your doctor how to control the migraine and if there is any other risks to the vasculature that increases the risk for clotting, stroke, etc.
Anne says, how are strokes and brain aneurysms connected?
So a brain aneurysm is basically a bulging of the artery, and if there is a bulging that is of certain size depending on the area it's at, a clot potentially can form there. The other risk would be for that aneurysm to actually rupture and then cause a hemorrhagic stroke, a bleed stroke. So it's always a good idea to keep an eye on the size of the aneurysm, the location of the aneurysm, and speak with your doctor if you need to see a neurosurgeon, an interventionist, or a neurologist to kind of control those risks.
Benita says she's been having a weird feeling in her left arm. She's on a statin and blood thinner. Should she be concerned about stroke?
You need to speak with your doctor because sometimes certain conditions look like a stroke, what we call a stroke mimicker, but is not necessarily a stroke. And if it's only one arm, potentially it could be related to the neck, it could be related to something else. Of course, it's always a good idea to speak with your doctor about your symptoms and see what they tell you about it and examine you properly.
And if you're having pains or pressures in your skull, can testing rule out a stroke?
So when we think about pain in general, we become concerned about potential bleed or what we call space-occupying lesion, something like a mass lesion. And yes, the CAT scan initially can rule a bleed out. Sometimes we need more sophisticated testing like MRI. But yes, the MRI can rule in or out a stroke.
I know you went through the Be Fast symptoms. Someone wants to know, like, how does it physically feel like when you're having a stroke? I mean, can you feel it inside your body, like when it's happening to you?
So it depends on the situation. For example, with bleed, yes, you can feel the headache. You can feel the numbness, the nummy sensation of your face. Or if you look in the mirror and your face is droopy, then obviously, yes, that's a sign of it. But it's not always like that. Sometimes it is people around you who needs to be aware of the symptoms of stroke, so that if they recognize it, you don't think twice. You go to emergency department as soon as possible. Even if you're not sure, better safe than sorry.
I want to thank you, Dr. Al-Kazmi, also Sarah Clements. You gave some great information. Thank you for joining us for this Hurley Healthy Living event. You can make an appointment for Dr. Al-Kazmi at 810-720-1335.